Hi and welcome. Today we are going to talk about the power of nitric oxide. Hi, my name is Dr. Ariane Missimer. I am a functional medicine practitioner, a doctor of physical therapy, registered dietitian, mindfulness instructor, and I am the owner of the Movement Paradigm Integrative Health Center. So nitric oxide is one of our most crucial molecules for bodily functions and overall health. One of the things that is known for the most is vasodilation. So of course, this can affect so many different aspects of our health, from erectile dysfunction to cardiovascular health, to even how we're able to get our blood and nutrients to our cells. When looking a little bit more in depth about the specific benefits, one of the things is blood pressure regulation. So a lot of the research that's been done with nitric oxide has been done in hypertensive patients. We also want to think about its ability to reduce platelet aggregation. Essentially, it is increasing cerebral blood flow. So this is really important as we're thinking about more blood flow and how we're actually getting our nutrients to our brain. Vascular function. So again, as I mentioned, this can be associated with erectile dysfunction. So in order to have an erection, as well as even for female sexual health, it is very important to have optimal vasodilation. In addition to that, it is going to reduce oxygen costs during exercise, so it can have an impact on performance. It can affect the mobilization of circulating angiogenic cells, therefore affecting bone marrow. It can affect mitochondrial function. And of course, as it relates to physical exercise, it can increase, as I already mentioned, the performance overall, but also reducing oxygen during exercise and enhancing muscle contractility. Now, let's get into the 6 ways that you can optimize your nitric oxide. So the first one is going to be improve nasal breathing. So it's important to note that nasal breathing is way more effective than mouth breathing for delivering nitric oxide from the sinuses to the lungs, because mouth breathing bypasses the nasal cavity, where is the highest amount of nitric oxide. So this is where we talk about the alternative pathway, which essentially is the parasinus pathway. So nitric oxide is essentially synthesized in the paranasal sinuses within the endothelial cells. This is going to create an accumulation of nitric oxide within the sinus cavities when we are nasal breathing specifically. When we inhale our air through the nose, the air is going to pass through the nasal passage, pick up the nitric oxide from the sinuses, transport it to the lungs, and this nitric oxide enriched air is traveling via the trachea into the lungs to ultimately help regulate the function of the airway and blood vessels. So then, of course, we can have more systemic effects from this, creating more vasodilation throughout the body. So as I mentioned, nasal breathing versus mouth breathing is very critical, but definitely not least is exercise. So historically, we know that exercise has had a profound effect on our cardiovascular system. So this is going to be no different. So this was a systematic review and meta-analysis of 25 different studies looking at the effect of exercise training on nitric oxide and nitrate/nitrite, the NOx production. And what they found was that based on the eNOS gene expression, that regardless of exercise duration, length, and type, aerobic training or HIIT training, exercise can significantly increase serum nitric oxide levels and NOx levels. So this goes to show that exercise, once again, is always a win and is going to be super important in our overall nitric oxide production. And the other thing that we want to factor in is called the NODE, the nitric oxide dump exercise. So this is a very well popularized exercise that was based on a study that they did. And essentially it is these 4 different exercises that you're supposed to do at least 2 to potentially 3 times a day. As it's been popularized, it takes about 4 minutes to perform, although in the study it did take them 14 minutes to perform. But what they found was that this did have a significant improvement in the systolic and diastolic numbers as it relates to hypertension. So it is a really cool exercise. So you can check out this video here. To perform the nitric oxide dump exercise, the NODE exercise, you're going to start with performing each exercise for 10 repetitions, and you're going to repeat the whole thing 4 times. So the first one is a squat. So as you're performing the squat, you can squat as low as feels comfortable to you, obviously paying attention to mechanics, making sure your hip, knee, and your foot are in line, and allowing the arms to raise to shoulder level. Then after you perform 10 of those, you would move into the circular arm motion. So you can start with your pinky together and bring your arm overhead like this. So of course you do want to be mindful of your shoulders. So you can modify this by changing the range of motion that feels comfortable to you, even bringing them out in front slightly. You can do that. Again, being mindful of mechanics so you do not cause any injury with this, but working on 10 total circular motions. Then you'll move into a shoulder press. So from here, starting with your arms bent, pressing overhead, like you're pressing something overhead, an object. And again, bringing your elbow slightly forward can accommodate for proper shoulder mechanics, working in a scapular plane. And then the last one is a march. So you can tap with your opposite arm. So this you would do 10 each. And then from here, you would repeat this whole cycle. So you would move back into your squats. You move back into the circular arm press. So you would do, again, 10 each, and eventually working on speed with this. So this is going to take you approximately 4 minutes or so when you're doing this repetitively. So once you feel like you've done that, you're going to feel like everything is pumping. So allow yourself to just really settle in and feel your body, feel this tingling that you'll notice in your hands, and typically your hands and your fingertips, noticing this vasodilation that's occurring, and really work towards increasing speed over time. And of course, even the endurance piece. You can add to this in terms of repetitions. You can repeat the cycle more frequently, working up to, in the study, they did a total of 14 minutes.